irreversible damage to the hip joint and it leads to arthritis. If hip preservation surgery is performed in these young patients, we can avoid or delay the arthritis, and in the future we can avoid or delay the joint hip replacement surgery. Keeping focus on this and other related issues, SAI Institute of Sports Injury and Arthroscopy today organized advanced hip preservation course. There are 300 orthopedic surgeons from all over India participated to learn these techniques focused on hip preservation joint. Dr. Prasad Gaurineni is born and raised in India. He is practicing in Chicago. He has a unique opportunity to learn the present day modern hip preservation from its beginning from original Swiss surgeons, and he has accumulated unmatched experience both with open and arthroscopy techniques since 20 years. And his surgical results are in par with any international experts in this field. He, in collaboration with us, is starting the hip preservation clinics in Hyderabad in SAI Institute of Sports and Arthroscopy to treat young adults and children with hip problems. Now I request Dr. Prasad Gaurineni to come and speak about the hip preservation.
So hip preservation basically means that we're trying to save the at-risk hip from arthritis, right? So arthritis means painful hip and replacement, like Dr. Reddy mentioned to you. So saving the hip that's at risk already. So we need to start identifying the hips that are at risk and treat them appropriately before damage happens. This idea started in burn. Like Dr. Reddy mentioned, I was lucky enough that right after my training, I was able to learn about this technique that's newly developed in Bern, Switzerland, and then we expanded it in the USA. And now I'm trying to, for the past 2 years, come to India frequently and try to expose people to what we learn. So hip pain and arthritis are becoming more common. In my generation, hip arthritis was less common than now, what you guys will see. Something is happening in our Indian culture. We're becoming more westernized. I'll say westernized because what we're doing is, when I was growing up, I was sitting on the floor, crossing my legs, squatting down frequently. People are not doing it anymore. So Westerns don't squat down, and the squatting, which allows the hip to develop properly, that's not happening anymore in children who don't squat. Right? That's probably why hip problem is becoming more common in India. So our culture of sitting down cross-legged and sitting on the floor, squatting, probably was beneficial in hip development, and that we're losing that today. So, like I said, some of these problems are preventable if we educate children to stretch their hips at a young age, sit cross-legged, squat for a few minutes, play sports that require deep bending, but at the right age. Between 5 and 10, probably it's a good age to mold the hip with activity modification. A lot of jumping and running, playing basketball and tennis between 5 and 10 is well known to cause these hip problems. Being healthy and active, you think it's good to play sports, but they do affect the hip development. So early recognition of these problems will allow us to prevent as well as treat them before problems happen. So this normal pelvis exercise, healthy patient, no problems. Luckily, we all have a healthy morphology. If the ball and socket are not perfect, with some because of my activities or because of disease, that gives pain and carefully. And people who used to pause and not stand 20 years ago, a hip that's turned upwards, people used to ignore it, saying that it's some development, some dysplasia, but that hip causes pain and arthritis. So we know how to correct that by tilting the head back down into the proper rotation. That's an operation I can do today to make the hip almost normal and give it a long leg. Right? That's called open osteotomy, proximal femur osteotomy, with varus and rotation of the head back into the socket correctly. Then we identified this condition called hip impingement for the last 15 years. Hilser and Kammer 2 types of impingement. The cancer is happening on the established side, where there's extra bone in the front that jams against the wall. And here, the wall has extra bone called can that's jamming against the socket. And both cause damage to the hip and pain. So, we used to do the bumpectomy is with open operation, you see how big the incision is. But today, we can do it with two small poke holes, skin incisions that are as big as 5 millimeters each, and do the same operation. Less pain, faster recovery, better results. The incision you saw here, to do the same little shaving of the bone, to what I have here, the 2 poke holes. Maybe 3 poke holes if required. So, if someone come looking for help, if it's not recognized correctly, they may go to the doctor first with hip pain, and if it's not diagnosed correctly, they may live with it because the pain is not terrible. It's not like cancer or something that's going to force you to see somebody. They can live with the hip pain. But the hip pain can proceed to being arthritic, cause damage, and it's preventable if you can recognize early. Like Dr. Raghuvi said, a lot of times they have knee pain, and people ignore the hip. You need to examine the hip, find the cause of the hip problem, and fix it. I want to come back and contribute to India, and this is where I found that my need is best felt. I know something that most Indians are not familiar with, and it's my opportunity to expose them. So we're trying to build a center for comprehensive preservation. Tirupati is being the base place called Amara Hospital in Tirupati. But again, Sai Institute is my Hyderabad hub place that I would come often, and there are a few other places in the country. Thank you very much.
Here, he is going to major cities, and he is putting this knowledge to the orthopedic surgeons who are not familiar with this method of hip preservation. So now we will go with case 1. Has fallen from the bicycle in December. So what happened in this boy, the ball has slipped on the thigh bone. This is the thigh bone, that is the ball. So ball has slipped, so that causes the damage. They can cut off the blood supply, they can go for arthritis, joint deformities. So if we recognize and treat early, so this is the thing we about. Then Prasad happened to be in this city in February, and patient was lucky enough to get operated. Otherwise, he his hands. And Dr. Prasad performed the surgery on 20th February. And fine. Can you come and walk with a stick? Where is your stick? Again here and there. No problem.
Sir, one photograph. Yeah, you also join. Yes.
And you can also join. I'm going to introduce you now next.
Please come, sir.